Good morning, colleagues. Thank you so much for coming and thank you for being with us. What I'm going to present to you is a case of MWANZA. And MWANZA city is in the northwestern part of Tanzania. It's the second largest city in the country. And as you can see in the photo, it's a combination of formal and informal, but largely the larger part of the city comprises informal settlements, which are on the hills and on the slopes of the city. At the same time, it's a city which has the Lake Victoria, the freshwater basin, the largest freshwater basin in Africa, and which is actually a very important source of fishing and subsistence farming. In terms of the promises and the trajectories, I wish to emphasize that sanitation question in MWANZA, as Adriana did point out earlier, overall efforts to prioritize and improve sanitation in MWANZA has been low in policy and action, especially among most urban households. What I'm emphasizing is that if you look at the study we've done in MWANZA, look at the policy review, look at action by municipalities, by local government and individual households, the priorities on sanitation is generally low. There are investments, but if you look at the demand and the needs, it's relatively very low, essentially because of resource limitation. I'll come to this later. Geographic, economic, and policy challenges. The other important thing is that we have a very unique situation in MWANZA, like many other cities. Sociocultural norms, which high incidences of poverty and related land problems. It's a rocky area, steep, and very poor access, especially on the hills. This collude to undermine households' initiatives to improve sanitation. What I want to emphasize is that at the individual household level, we have sociocultural norms, which Adrian did emphasize that sanitation is highly gendered, and you can see this transparently in MWANZA. At the same time, we have high levels, incidences of poverty. These are very critical factors which are really colluding to undermine initiative to improve sanitation. And also it's important to emphasize that over years, if you look at the trajectories of sanitation in MWANZA, over years, emphasis has been on improvement of water supply, potable water supply, and very little concern for what happens to the wastewater, which is generated both in terms of human fecal sludge and other liquid waste, which is coming from the environment. Before 1996, sanitation and water supply in MWANZA was managed by the local authority, municipal council, MWANZA Municipal Council. After due to the poor performances, inadequate supply and coordination, inefficiencies of the local management system, in 1996, the government established MWANZA Urban Water Supply and Sanitation Authority, essentially to address the inadequacies, inefficiencies, and the lack of knowledge, especially and understanding of sanitation improvement options among local communities. Which means ideally, MWANZA was given a very big agenda to try to look at the entire question of sanitation with a view to improve sanitation, with a view to improve understanding, with a view to support especially households to improve their sanitation systems. At the same time, it embarked on also improvement of different modes of sanitation, especially the grid system, which was the city center. Next, please. This is one of the improved sanitation system which has been made in MWANZA, and this is a very important one. It's connected to a simplified sanitation system which has been erected by the municipality as well as by NGO, the CCI. A promise, in terms of promises, MWANZA was also required to raise funds from different sources to be able to supply to improve sanitation in MWANZA. And this include from development partners such as KfW, EU, French development organization, which put a lot of money to try to support MWANZA MWANZA urban water supply and sanitation to improve the sanitation area. This fund helped to improve toilets to 2,490 houses in 1917 under Lake Victoria Water and Sanitation Project. Later, the funds were used to support to improve simplified sanitation system, and this was adapted for the first time in MWANZA, and with a total of 6,432 houses connected to the system. This was a very big improvement. At the same time, it is important to understand that this marked the trend towards improving sanitation for low-income people, households, especially those on the hills, where digging deep toilets is very difficult, where access by cesspit empty vehicles is impossible almost, and where also there is a shortage of water to drain or to wash down the waste. Although the idea was to improve sanitation conditions citywide, the project has largely focused on planned settlements. Only a few low-income households on the hills were reached. What I want to emphasize that despite the concern of the poverty of the poor people on the hills, despite the challenges on the terrain, subdued by terrain poverty, the focus has been, like in all other cities in the country, and like all other sectors, including the planning system, tend to favor the middle and high income. The sanitation has been largely focused on planned areas. Only 5% of the people have access to sanitation, simplified sanitation system. 75% use off-grid, essentially septic tanks and pit latrines. This shows how the severity of the problem of sanitation. And when we are talking about septic tanks, it's not much. So very few people can do that. A proper septic tank and improved pit latrines. Open defecation persists, especially on the hill areas and on the crowded areas in MWANZA. MWANZA is surrounded, as I said earlier, by hills, and these are dominantly occupied by poor people. Overall, outbreak of diseases, this improvement which have been done over years and which are still going on, despite not so much on the sanitation, but whatever has been done in MWANZA, we must acknowledge that the outbreak of diseases such as cholera, typhoid, diarrhea has declined, but sanitation remains a critical challenge, especially because of, one, ineffective bylaws. We have bylaws which are enforced by the municipality, which are not really making a difference in terms of being adhered to. And people have adapted their own ways of doing things outside these bylaws. Second, the difficulties, poor fecal sludge management system or approaches, which are adapted by cesspit emptiers, manual cesspit emptiers, which do not regard so much adequate public health concerns, and poor coordination among the key actors, the municipality, the utility, and the sanitation workers, including cesspit emptiers. These are very critical concerns. Of course, you can add this one, the social cultural norms which persist and which tend to focus on other priority in sanitation not being given a priority at household and policy level. Thank you. Basically, this is what we have seen in MWANZA. Thank you for listening.